Imagine this. Your child's school bus is weaving erratically down the road. Any parents in here? Okay. The driver stops, opens the door, and says wearily, "Good morning. Don't worry, I'm not drunk. I just haven't slept in 24 hours. Would you let your child get on that bus?" We understand impairment when it's from alcohol, but we don't talk about it when it's from fatigue, even though the science is clear. Fatigue is impairment. One classic study looked at essentially alcohol compared to fatigue and found that after 24 hours awake, impairment was similar to that of being legally drunk or having a blood alcohol content of 0.1%. In every other industry, sleep has strict regulations. Pilots are mandated to sleep, truck drivers, bus drivers, they all have strict limits. But not doctors. We know this, we're doctors here. We work 24 hours, 28 hours, 36 hours, and often much more. Why? Part of it is tradition. In the 1890s, a surgeon named William Halsted created the model for residency training as it exists today. Residents, hence the name, had to live at the hospital, remain unmarried, and had to be available to work 24 hours a day, 7 days a week. But there's an uncomfortable truth here. Dr. Halsted became addicted to cocaine while testing it as an anesthetic. And then he later used morphine to fall asleep. He relied on his residents, working nonstop to cover up his addiction. This created a trickle-down cultural norm where sleep was deemed unimportant. The larger reason that this system of sleep loss persists is really the culture we've created around the status quo. It's a hyper-competitive culture where doctors are rewarded for appearing superhuman. It's a healthcare system that is financially strained to its limits, and it's a growing workforce shortage that makes coverage feel impossible to redesign. Replacing this with safer staffing costs real money. One analysis from the New England Journal of Medicine said it would cost $1.6 billion a year to implement safer sleep reforms nationwide. So sleep loss in medicine has been normalized, even considered a virtue. The truth is that it's a system flaw, and systems can be redesigned. Here is the idea I want to share today. Sleep is at the center of safety, both for our patients and for the people caring for them. So first, let's look at patient safety. When we are sleep deprived, we're not just groggy, we are impaired. Our memory shrinks, our working, essentially memory and attention decreases, our coordination becomes impaired. We're more confident than we should be and more error prone than we realize. And we all know this, that in a hospital, a small lapse is never small. It's a missed allergy, a decimal point, a medication dose. In one landmark study, they found that doctors working extended shifts of 24 hours or more had 36% increased risk of making a serious medical error and made 5.6 times more errors when making a diagnosis. Here are some quotes that doctors have given me permission to share. As a surgeon, I fell asleep while operating on a patient and collapsed into their open abdomen. Imagine if that was you or your loved one. In the NICU, I ordered 4 times the strength of a baby's sodium supplement. I felt so guilty. I once gave a patient too high a dose of insulin, and they had to be rushed to the ICU. These are not careless people. These are trained professionals that are working under what we would call impairment in any other industry. And the truth is that when we ask doctors to practice medicine when they're sleep deprived, we are building preventable risk into care. Sleep is at the center of safety. And it doesn't just affect our thinking. It actually affects something even more central to healing, our empathy. We know that when we are sleep deprived, we have a decreased ability to process emotional information. If we look at MRI scans of people after a night of no sleep, they have far less activity in the empathy areas of their brain. And if you've ever had a newborn baby, or you've taken a red-eye flight, you felt this, right? Our empathy fades when we're exhausted. There's also research to show that doctors who are low on sleep, they feel less empathy for a person in pain, and tired doctors prescribe less pain medicine. Here is what doctors have told me. I'm a hospitalist, and I was once so tired, I was glad when a patient left against medical advice, so I had fewer patients to round on. As a resident, I was asked to stay and operate on a patient with ovarian cancer. I was so exhausted but couldn't say no. We soon saw that the cancer was terminal and had spread throughout her body. The surgery was stopped early, and I felt an immediate relief that I would finally be able to sleep. I'm still horrified. This was the first emotion I'd felt after finding out she would die of cancer. I'm a surgeon, and I was once so exhausted on call and about to see a new patient when I heard a code blue announced for their room overhead, and they died soon after. I remember feeling relief that they had died because it meant I had a moment to rest. I still feel terrible about that. These statements sound shocking because they are shocking, right? They're also not just one-off stories. These are common experiences that clinicians can face when they're sleep deprived. And in healthcare, the stakes of this are enormous because when doctors show compassion, the data is very clear that outcomes change. When we as doctors listen to our patients, we connect with them and we show compassion, we're actually more likely to get the diagnosis right. We need fewer referrals to specialists, fewer diagnostic tests. In turn, patients have less anxiety when they go to the doctor. They're more likely to adhere to the treatment plan. For all of these reasons, when doctors show compassion, healthcare costs go down, malpractice lawsuits go down, medical errors go down. So when exhaustion erodes compassion, it's not just tragic, it's dangerous and expensive in more ways than one. It also can harm us as clinicians when we are sleep deprived. Chronic sleep loss, the data is becoming increasingly clear over the last 30 years that it increases our risk for heart disease, diabetes, stroke, and even cancer. We also know that it can increase the risk of accidental harm. It looks like the needle stick at 4 a.m. because your coordination is impaired. And we all know that a needle stick is not a small thing. It can mean months of testing, medication, fear, and waiting to see if you've contracted an illness like hepatitis C or HIV. In one study, they found that needle sticks were significantly more likely to happen during extended shifts of 24 hours or more, and more likely to happen at night than during the day. One study found that the 29th hour of the shift was the average time of an injury. And then there is the drive home. We ask doctors to care for patients all day and all night, and then we send them onto the road impaired. Some doctors miss exits, fall asleep at red lights, get into fender benders, and some tragically never make it home. One study found that when doctors are working 24 hours or more, they're twice as likely to report a car crash and 6 times more likely to report a close call. And here's what doctors have told me. I fell asleep at the wheel last week after being awake for 24 hours on call. Every colleague I've spoken to has said, oh yeah, that's happened to me too. I was driving home after a labor and delivery shift and had delivered 8 babies. I fell asleep on the freeway, hit the guardrail, and my car got towed. I'm lucky to be alive. Another said, a neurosurgeon in our program who'd been awake for 30 hours, fell asleep at the wheel, and unfortunately died on the commute home. And another one said, I fell asleep driving home, and my car stopped by itself an inch from a school bus. It was horrifying. This is not just a workplace safety issue. This is a life and death issue for clinicians and for other people on the road. And then there's the cost that we never talk about, because we as clinicians are trained to hide it. Sleep loss alone increases the risk for anxiety, depression, and suicidal thoughts. It's an independent risk factor. And when we combine chronic sleep debt with moral injury and grief exposure, we get the makings of a mental health crisis. Many clinicians have anxiety or depression and suffer in silence because they're afraid of professional consequences or stigma. When I was severely sleep deprived for 5 months in a row, I started having thoughts of suicide. It was one of the most devastating periods of my life, and it took me months to climb out of that. Here's what doctors have told me. I became so sleep deprived that I was depressed and started to have thoughts of suicide. I voluntarily went to the ER and was admitted to the hospital for 5 days. My sleep loss got to the point I was having daily panic attacks before my shifts. Nearly every time I'm awake for 28 hours or more, I have thoughts of suicide. Sometimes I wish my car would crash just to have some relief from being so devastatingly tired. Sleep loss can also push our brains toward hallucinations, psychosis, even paranoia. I've had countless doctors tell me about their hallucinations, seeing people walking in the road, feeling bugs crawling on their skin, hearing voices that weren't real. And once, when I was awake for about 60 hours, I was in the emergency room taking care of a patient, and I started hallucinating shapes and images on the wall. And here's the most dangerous point. Even when our minds are slipping, we're still expected to make life and death decisions for patients. Sleep is at the center of safety. So what do we do? How do we change a healthcare system that has normalized sleep loss despite its tragic outcomes for patients and clinicians? Like every other industry, we must treat sleep like what it is: safety infrastructure. We stop treating it like a luxury, and we start treating it like hand washing and sterile technique. Here are 4 steps we should begin taking immediately. First, we must recognize that fatigue is impairment. Fatigue is not weakness or lack of grit, it is impairment. We, as a healthcare society, as professionals, we have to take a hard look at the data and acknowledge the harms of sleep loss. Rest has to be built in, protected, and reinforced, not treated like a personal failing. And yes, making these changes will cost money. But the real question is the cost we are already paying in terms of medical errors, disability, lawsuits, turnover, and especially lives negatively affected and even lost. Second, we have to work to remove extended shifts and redesign coverage wherever possible. Even within our current frameworks, we can work to shorten shifts, strengthen handoffs, and allow for cross-coverage. We also need to remove urgent work from nights as much as possible and shift some of that into routine daytime workflows. Rest also has to be prioritized. So if you're a doctor working a long shift, which might end in the morning or early afternoon, you should not be penalized for missing a lecture or a meeting when sleep is what you need most. Third, we have to protect clinician health. When long shifts are unavoidable, doctors need rideshare options, real rest spaces for during and after a shift, and accessible mental health care. And fourth, we have to prioritize people over profits. Healthcare leaders, like all business leaders, face the challenge of having more problems than money to solve them. In a world where headlines are made by investing in the next best IT system, or AI platform, or merger to increase market size, the headline we should chase is this: no patient was harmed by a preventable medical error. No clinician died from suicide or from a car crash on the way home. What if the future of medicine isn't built on the illusion of superhuman endurance? What if we stopped romanticizing the clinician that can function without sleep? Because our patients don't need martyrs. They need minds that can think clearly, they need hands that can operate with steadiness, and they need hearts that still have the ability to show compassion. And clinicians, we deserve to be mentally and physically well. We deserve to get home alive. So I'll leave you with this. Sleep is at the center of safety. Our patients deserve to be safe, and the people caring for them deserve it too. Thank you.